Hello, everyone, and thank you for joining us, and welcome to our second episode of our podcast. I am Sanjay, and Zoe is also my co-host. So today we'll generally be touching on emotions such as excitement, anxiety, and stress. And on today's episode, we'll be mainly focusing on anxiety. And with us, we have Dr. Reena Dabas. Let's welcome her.
Yeah, hi Sanjay, hi Zoe, and hi everyone. Thanks for having me here. It's my
Yes,
pleasure to talk about something that I always work with on anxiety.
yes, thank you, Dr. Reena, for being with us. So, before we start on our topic, tell the audience more about yourself, Dr. Reena.
Okay, I was teaching with UB until December, and I'm a certified clinical counselor with the Singapore Association of Counseling. So I had a teaching experience of 20 years where I was teaching psychology and 10 years of my own private practice. And I was dealing with the cases of anxiety, depression, relationship issues, parent child issues. That's where I worked with.
Hmm. Fantastic to hear, Dr. Reena. So, let's just get the ball rolling and let's start with the topic at hand. So, let's start off with what is anxiety?
Um, Anxiety is, I can say that is our body's natural response to any stressful situation. And it is more like a feeling of fear, or I can say that apprehension about what's to come next. So like the first day of the school, I'm sure when you started the school, there's some kind of feeling that you had experienced, or going for a job interview, or maybe giving a speech. So I think these are the some of the reasons or some of the causes why most people feel very fearful and nervous. So this is what we can say. And anxiety comes with the physical symptoms, like, different people show different symptoms like shaking, sweating. Mostly like we might feel constantly on edge with a sense of like dread about the future. Oh, what's going to happen next? So this is what we can say anxiety. And I think I would like to differentiate that with nervousness, because most of the time people get confused between nervousness and anxiety. They don't understand how we can differentiate it. So nervousness is more like a temporary and a situation specific, whereas anxiety is more enduring. And anxiety more interferes with our daily activities. Whereas nervousness, it happens for a while and it just goes away and it doesn't interfere with our daily activities. So I think it's very important for us to, when we talk about anxiety, it's very important for us to differentiate that with nervousness, because that's, I always feel sometimes when I talk to people, I realize that it's just a simple nervousness, it's not anxiety. So whenever I talk about anxiety, I always make sure that I make people understand how it is different from a nervousness for us there. And so it's more, I can say that like overwhelming feelings that we have. And when it start taking toll on our health or well-being, that's what we can say anxiety.
Okay, thank you, Prof. So, our next question to you is, why do we feel anxious?
You see, if I say that, why do we feel anxious? I will put it as there is a very evolutionary reason behind that there. Because understand, in the past, okay, let's take anxiety. It's more like a reaction to the perceived threat or stressful situation that we have. So let's go back to prehistoric times there, when people lived in caves, not in cities. So what was the most significant threat to personal safety there? It was like the predators like lion, tigers, animals, like those kind of animals. And if you encounter one of those face to face, it make you perfect. This is what we can say is a perfect sense of feeling anxiety, right? So what the people were doing were, the people who were being protecting themselves were getting away from them. So because of that feeling of anxiety that they were feeling, they try to protect themselves. So anxiety evolved as a way of helping to keep us out of danger. Now we don't have those predators, but we have other things around us there. So it has an evolutionary basis. It gives us evolutionary advantage by altering us to when situations were not safe. So without anxiety, you will not react when you are in danger. And we likely wouldn't be alive today without it. So I will not say that anxiety is always bad, because anxiety is something that actually can protect us, that actually can help us to survive. But definitely when it start affecting our you know social, occupational, personal life, relationship well-being, I think that's where it is being something that we need to look for, or we need to seek help for that.
So, Dr. Reena, actually, I would like to ask you a follow-up based on what you had mentioned. You said that anxiety normally happens because it's a reaction to a perceived threat. But
Hmm.
I would like to ask if what are some of these perceived threats that we could like some common perceived threats that we could have, like any common triggers that would kickstart this anxiety in us?
Mm, it depends upon different age groups, I can say that. Like
Mm,
when we talk about people of your age, like young age group. So
mhm,
I can say that, social engagements can be one of the factor where social anxiety can trigger uh, for an upcoming social event, and or it could be, your schoolwork, because some of us we have this tendency to be very perfect always there. So feeling the pressure to be perfect can easily lead us to this feeling of uncertainty, overwhelm, and anxiety. Also, we can say lack of support. So, sometimes when we don't have a good support system to lean on, then anxiety may come up. Other things can be substance use, because certain substance use, they also can make the people feel anxious. So there's a long list. I can just share a few of
mm,
these lists. Relationship issues, that's coming up very big in young people, because they start relationship very early, and then when they are not being aware of their own identity, and when the relationship, so they feel that anxiety throughout that phase of it there, where it can come up because of multiple other issues like past traumas and other things, but the anxiety is always there. And also it can be overwhelming schedule, like many of us, we are working, we are studying. So to balance this work life is like or you can say when your schedule is very overloaded, so all these things lead to intense emotions in a person. um, Transitional life phases, so where we can talk about, like you know like you were in school before, or JC or poly, and then coming to the university, that's a life transition phase for us there. And then when we finish our study, and then we formally get into a work environment, that's on
mm,
another transition of the life. So these things, they also create anxiety in some of us. Other things can be conflict, like tension with friends, family members, or partners, or even co-workers. They also can lead to the shaky emotions in us there. And also we can talk about other things like financial issues, like economic concerns. So the list is pretty long, but I can say one of the things that mostly lead it to is a negative mindset of the people. You know, if in our day-to-day life, or our day-to-day thoughts, they are more negative, then anxious feeling automatically comes in us there. So I will say that all these are the situational factors, but above all is negative mindset of the people. So that's where it leads to more anxiety in us.
mm.
So, Prof, just now you mentioned about the difference between nervousness and anxiety. So, what
Hmm.
about the difference between panicking and being anxious?
Okay, what happens is that actually uh, panic attack and anxiety, we use them interchangeably, but actually they're two different things there. And the difference lies in terms of the severity and the cause. of these two. So, like, if I say anxiety, or I can say anxiety attack, it's a feeling of overwhelming um, um, apprehension, or I can say, worry or distress or fear. And anxiety builds slowly, and it get worse as stressful event approaches. So you can understand, like, it is something that is being developing slowly in us there, and then it reached that level of worst feeling in us there. Whereas panic attack is abrupt. It's abrupt experience of that intense fear, or I can say discomfort in us there. And it is accompanied with physical symptoms like, heart rate increase, chest pain, dizziness, shortness of breath. So you can see they're the two different things. One is very abrupt and severe physical symptoms, and anxiety is more slowly it develops in us there, and it builds slowly in us there. And anxiety is mostly towards related to something that is perceived as stressful or threatening, whereas panic attack, they're not always I can say cute. It's not something that we have a cue and then you get panic attack. Sometimes panic attacks can come out of blue. It can just happen. So that's where we can see that they're pretty different. The two of them are different in terms of their nature. And other thing I can say is that anxiety attack can be mild, moderate, or severe, whereas panic attack is always very disruptive. It's very, very disruptive symptoms that it comes up with there. So that's where the basic difference comes in. So we need to be very clear about that it's an anxiety attack or it's a panic attack. So just to sum up this part there, anxiety attack, it develops gradually in us there. And the symptoms may be mild to more severe, whereas panic attack is very abrupt and it has very intense physical symptoms with that.
So, Dr. Reena, you were saying that how these anxiety attacks and panic attacks, they all have varying impacts on us. But do you feel that there could be any practices, anything that we could do to help to reduce this from happening, such as maybe any mindfulness practices, meditation practices?
I think definitely if I talk about mindfulness and meditation, they definitely will help us to reduce anxiety. I can talk about mindfulness because that's what I practice a lot also. So I will call that as a skill and a practice to control anxiety. So because just to briefly define it, I will say that mindfulness is basically a non-judgmental awareness of the present moment. Because if you remember, I just talked about anxiety as a future apprehension, where we think that I don't know what's going to happen next. If that happens, so that is a future apprehension. So we are time traveling, where we are being talking about future, past. So we don't stay in present. And interestingly, why we don't stay in present also because we are very judgmental about our present awareness, our present moment. So that's a reason people have this tendency to time travel, future or past. So mindfulness, it actually is a kind of like where we have a non-judgmental awareness of the present moment. So that's where we can be here and now, not in the future or not in the past for us there. So, I mean, why I'm giving this basic of mindfulness, because this is going to help you how it reduces anxiety, right? So mindfulness is basically, I can say, a self-regulation of attention, where I regulate my attention to and also to make us more oriented towards our present moment. So I can see that two things are happening here. One is a self-regulation of attention, and second is our orientation toward present moment. And these are the two things that helps us to reduce anxiety, because that's what anxiety is, where we can't regulate our attention, where we are time traveling, we're not in present moment. So mindfulness helps us in both of these two things there. So that and that actually brings that acceptance of our present moment, where we accept where we are. So like I'm sure you people have all experienced it. I have experienced it multiple of times there, when we avoid focusing on our present moment, because focusing on the present moment, it requires a lot of cognitive efforts from us there. So because we have to face many things, right? So mindfulness helps us to uh, focus on our present. And if I say, what it leads to make us behave in a more reflective manner than reflexive manner. So it is helping us to more focus on our present in a more reflective manner. So I think that's how it can help in reducing the anxiety. So what we do with mindfulness is that we focus on breathing, exercising. So like where we connect ourselves to that breathing. So we focus the mind on the breathing, and that help us to connect on the present moment. So we simply start with each breath, and then we actually can observe as we inhale and exhale, and that's how we can bring us our focus to our present time by focusing on that there. And another thing that I would like to highlight also is that mind and body connection. Because understand one thing, because why I'm giving this detail, because that will really help you to understand the reasons of anxiety and how mindfulness can help with that there. I'm sure you have studied in your psychology modules, where we talked about sympathetic nervous system, where we talk about fight and flight reaction. And that's what is the basis of anxiety. I can say that, whenever we of some fearful thought comes to us there, it activates our sympathetic nervous system, and that's where people get into this flight and fight mode. And this flight and fight mode, it actually releases some hormones and chemicals, and this brings our anxious thoughts, strong emotions, uncomfortable physical sensations that we can feel that there, and we start losing control. And that's where this anxiety is everywhere in us there. So through mindfulness, we help to interrupt this vicious cycle of, fearful thought, sympathetic nervous system that leads to fight and flight. And then we get these kind of strong emotions in us there. So we actually interrupt this cycle with mindfulness there. So we stop when we are getting into this mode of fight and flight. We stop that by focusing on our breathing, and also understand that it's very easy for us to jump to the conclusions, isn't it? Like, predicting that catastrophe is happening around us there. Even I think we all have to understand this thing, that our worst fears rarely actualize, but we are so good in making these scenarios in our mind. We imagine embarrassments, we imagine rejections, failures, and hardly few of them actualize, or I will say they rarely actualize actually. So we have to put a pause on that there. So we have to put pause on these projections that come to our mind. And how we can do it? By observing our thoughts, and just to see that these thoughts are simple thoughts. They're nothing. They don't predict anything. And then these kind of thoughts, they start losing power. So I hope it is clear that what mindfulness does to us. Mindfulness helps us in our mind-body connection. Mindfulness helps in our making us non-reactive with thoughts, where we just take thoughts as just thoughts, and they just pass by. So that's what mindfulness does to us there. And I have given you a big detail on that there, because I personally feel that, even when I work with the people and on mindfulness, I always tell them about these things, because it's very important for us to understand how a treatment works, how any therapy works, rather than just blindly following, oh no, my therapist have said that I have to do mindfulness, so I'm doing mindfulness, but you do not know what it is doing to you there. So I always believe that when we talk about the treatment, it's very important for the people to first understand what this will do to you. Then it is much more effective, and then you practice it more diligently and you see the impact of it there. So sorry I've taken so much of your time to explain so much in detail on mindfulness, but I think that this is important for us to understand so that we know how it works well with anxiety. Meditation is, I don't practice meditation much. So it's more to relax and I can say calm our mind. So where in meditation, we focus on one thing, and that focusing will help us to get rid of that stream of thoughts that may be overcrowding in our mind and, causing that stress to us there. So it actually gives that sense of calm, peace, and balance. I can say that benefit our emotional well-being. So that's about the two things that you just asked: mindfulness and meditation. There are other ways also that we can use to reduce anxiety, and I feel the other ways can be reframing, where we think, stay positive. So I think that is another very good thing that we have to practice, by noticing the thoughts, and then you just question your thoughts, and then you just replace those thoughts with more helpful ones. So I'm sharing with you these because I practice these a lot with my clients, how they can reframe the thoughts and how they can use mindfulness and physical activity, engaging into physical activity. That's one of the best thing I can say that.
Right. Thank you, Dr. Reena.
Thank you, Prof, for sharing some of your techniques on reducing anxiety. Do you have any final lasting advice for the audience?
I will say that the one that I was talking throughout this session is that always remain present, try not to time travel, and also always remember this thing that as what I say, that how we may have these catastrophes and we have these predictions in our mind there. Always remember one thing, that these kind of thoughts, even the worst thoughts, they really actualize in our life. So rather than being so much rigid on these kind of things that comes to our mind, or focusing on more on those negative aspects, we need to be more cognitively flexible. I think that will really help us. And more acceptance, more openness, I think that will help us a lot in this phase.
All right. Thank you so much, Dr. Reena, for being here with us today.
So much for having me here. And I hope what I shared with you, my own personal experience with my clients, that will help you.
Thank you, everyone, for tuning into this podcast. We will see you in the next episode.